I'm Gerald Meis. I'm a pulmonologist with Mainline Health. I practice all aspects of pulmonary medicine, including asthma, emphysema, lung cancer, pulmonary fibrosis, sleep apnea. Anything that has to do with pulmonary medicine, we can do in the office and take care of. My philosophy when I'm dealing with a patient is to use my years of experience to help guide them to feeling better. And I like to explain to the patients exactly what's going on so that they understand what they need to do, what they're dealing with, and they help me help them make a decision about how to further their care. I see a lot of patients with lung nodules. We evaluate those patients and follow them on studies to make sure that a lung nodule doesn't turn into a lung cancer. We do that by getting x-rays and we follow CAT scans. When I'm diagnosing a patient with a lung nodule and I believe that they need further workup, I can send the patient to have an ion robotic biopsy. The physician can drive the scope exactly to the nodule and do biopsies of nodules that are 7 millimeters, 8 millimeters, pea-sized. It has become a game changer for diagnosis of small early lung cancers. Asthma is very scary. We see a lot of patients in the office with asthma. Some of the symptoms include shortness of breath when they're exerting themselves, wheezing in the chest, chest tightness, inability to do exercise. A lot of patients have symptoms related to allergies. Asthma is diagnosed by clinical exam and pulmonary function testing. We give patients medications that help open up the bronchial tubes, and usually they're inhaler medications. There are other medications too that are out now called biologics. These biologics help prevent that allergic pathway that eventually lead to airway constriction. They've been game changers. COPD is a broad term, chronic obstructive pulmonary disease. There are forms of COPD that we can diagnose more specifically with a pulmonary function test. Patients get short of breath when they exert themselves. They can't do what they want to do around the house. Patients that wheeze, patients that need steroids, they go on these biologic medications, and that's kind of newer therapy for COPD patients. One of the other treatments available to help treat COPD is pulmonary rehab. It's run by respiratory therapists. They help patients set a plan up for exercise, and they come out and feel better, able to do more. Pulmonary fibrosis is a very tough disease. It can start out as a cough and slowly progress from there. Some types of idiopathic pulmonary fibrosis have a latent period where people have minimal symptoms for a while and it gets worse at the end and makes it really difficult to treat at that point. So the earlier the diagnosis, the better. And there are some newer medications out to prolong that latent period. What satisfies me the most about treating our patients is when they come into the office and they're confused and upset about what they might have and they don't know how they got there or where they're going, and I'm able to help sort things out and get them on the right path to feeling better.